Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic in obstetrics is antenatal care. In this section, we will talk about different things and we divided it into 5 sections. In the first section, we will talk about the routine antenatal care. And in this routine antenatal care, we will talk about pre-conceptual care, some vitamin supplementations, risk of substance abuse in pregnancy. In the second section, we will talk about clinical examination and screening, and we will talk about the changing demographics in pregnancy, booking visit and obstetric history, and routine screening tests. In the third section, we will talk about infections and fetal anomaly. And we will talk specially about the rubella, syphilis, and hepatitis, also HIV, UTI, and group B streptococcus. Gestational diabetes, knuckle translucency, and biochemical screening. In the fourth section, we will talk about the dietary advice to the pregnant women, which include energy and protein intake, fats and carbohydrates, and also minerals and vitamins. And then in the fifth and final section, antenatal education, very, very important topic. In this, we will talk about the exercise and coitus in pregnancy, breast care, social and cultural awareness, and safe prescribing in pregnancy. So all this will be covered in the important topic of obstetrics, which is antenatal care. So to learn more about this topic, keep watching sqadia.com.